Good morning. This is the interview for an endorsement in Oregon House District 33. We have 4 candidates who are seeking to replace the outgoing Mitch Greenlick. He was outgoing in more ways than one. And we'd like to begin by asking each of you to tell us about yourselves and where you're from and why you're running. Why don't we start with Saren Bussel?
Great, thank you. So my name is Saren Bussel. I use she, her pronouns, and you can remember my name because it's Saren like Aaron with an S, and it comes from my parents couldn't decide between Sarah and Aaron, so I got Saren. And it's Bussel like Russell with a B. So so Saren Bussel, I'm running for House District 33. I'm a geologist and dog mom and union member and formerly chief of staff to State Senator Jeff Golden. And I have a bachelor's and master's degree in geology and an MBA from Willamette University. And I worked at multiple public agencies to protect the public from landslides, and also a regional agency, regional government metro, to make sure that our solid waste department and facilities and parks department had the resources they needed to help the public. And I'm also the board chair of the Crag Law Center, which is an environmental nonprofit that stopped Nestle from bottling public water in the gorge. And I'm also the chair of the Portland Open and Accountable Elections Commission, which is the public financing program for mayor, city commissioners, and auditor in the city of Portland. And I grew up in North Carolina, where I watched overt racism on a daily basis. And then many years later, when I moved to Oregon, was frankly shocked by the systemic and institutional racism that I saw playing out here in quote unquote progressive Oregon. And then having worked in the state capitol, watching many of our leaders not put racial, social, and economic justice first in all the decisions that they were making was frankly appalling. And we need to be asking the questions on every piece of legislation: who benefits, who's impacted, and are there equitable outcomes for everyone? And so that is why I have decided I'm running on issues that put racial justice, social justice, and economic justice first, including campaign finance reform, healthcare and housing for all, and addressing climate change.
Great. Maxine, why don't you go next?
Great, thank you so much for this opportunity. So I'm Maxine Dexter. I am a physician, a mother, and a healthcare business leader who grew up in Bothell, Washington. It's just a suburb outside of Seattle. It wasn't a suburb when I grew up there. It was a small little town. I was fortunate growing up in a working class family to have a great school district and a resilient community. And the reason I'm running for this is because I believe that every working child and family deserves the same shot that I had in life. I had a mom who really struggled desperately with mental health and anger issues, so our home was not necessarily a safe or a happy one. And so the neighbors in my community gave me some refuge, and the teachers in my life really inspired me to be a physician and never looked back. If it weren't for a union job at 16 that allowed me to get a great wage and full benefits, I wouldn't have been able to leave home at 17 and pay my own way through the rest of high school, college, and into medical school. Affordable state university and federal student aid allowed me to achieve my goals of being not only a political science and journalism major as an undergrad, knowing I wanted to do health policy in the long term, but also going to medical school at the state school. I now am a pulmonary and critical care physician taking care of the sickest patients in the hospital, and those include our COVID-19 patients. So I am very much in the middle of all this right now and really appreciate that perspective as I run for office. I am in this first and foremost because we absolutely need universal health care, and I have the experience to lead that, having been the first woman to be chair of the board of directors at Northwest Permanente, which is a mission-driven, physician-owned corporation that partners with a nonprofit. So we really do the right thing for our patients because it's the right thing to do, and I understand the fiduciary accountability that comes with that. So I'm grateful to be here, and I look forward to your questions.
Great. Andrew?
Well, good morning. My name is Andy Saltz, and I'm running in the Democratic primary for House District 33. I'm an educator, father, and career union member. Just graduated from Oregon Labor Candidate School. My partner and I actually grew up in House District 33 and started dating when we were 16 years old and are raising our two boys, who are 3 and 2 years old, in the neighborhood we grew up in. And I like to tell folks that the ultimate measure of a community is if people want to move back there and raise their family. I'm running for this office because I'm worried about our state and our country. And I'm particularly worried about the future for the next generation. Oregon has the second worst high school graduation rate in the country. We have the shortest school year in the country. Estimates are COVID will lead to a year's loss of learning for kids, and that will most impact our students of color and our students living in poverty. I am currently a professor of education policy, and for the past decade have studied state accountability systems. I'm also the director of the PhD program in education and leadership. So I'm running to make sure the next generation has equitable opportunities in education, a clean environment, and a healthcare system that works for everyone. The last thing I'll just say is, in light of COVID, we're going to have to do a lot of rebuilding of our economy. And I'm the only person in this race who has served in elected office. I was on a school board in Michigan during the Great Recession. And that experience in public service taught me a lot about budgeting. I've worked in the Senate Fiscal Agency as well. Estimates are that Oregon will lose 250,000 jobs by July. That's an EPI report. And so the 2021 session will be about budgeting and rebuilding the economy and helping our students transition back into schools. Those are things that I'm really prepared to do.
Thank you. Christina.
My name is Christina Stevenson, and I'm also running for House District 33. As you know, I'm a mom, I'm a civil rights attorney, and I have my own small business. I was born and raised in Washington County, and honestly, every single day, there's another reason, there's a new reason why I'm running, but I can tell you, why I originally went down this path. It was 2012, and my dad was passing away from cancer. And I remember I was in the hospital room with my dad in what would be, his last hospital stay. And my mom looks over at me and she says, don't you have to go to work? And I told her, actually in Oregon, I have job protection because for this time for caregiving, which was a really good thing because I had just been hit by a car, riding my bike to work. I was drowning in student loans. I needed that job protection. But what I learned when my dad passed away is that as soon as he passed away, I no longer had job protection. And I thought this was just insane. So I did a little bit of research and I rallied my grief support group. We showed up in Salem and we got bereavement leave added to the Oregon Family Medical Leave Act. So this was 2012, and this was the third time that they were considering adding this just basic human dignity to the law. This is just not to fire someone when their person passes away. This is not even paid leave. So it really made me wonder, what are the values that are leading this legislature? And I can tell you what I value. It's economic security and an economy that works for everyone, affordable, equitable systems of care. And that means childcare, healthcare, elder care, and livable communities with strong schools, clean air, and affordable housing. So that's why I'm running.
Great. Could you give us a little bit of biography about what you've done and where you're from?
Me?
Mm-hmm.
So, like I said, born and raised in Washington County, and then I went to American for undergrad, came back here, U of O for law school, and have had my own law practice, practicing civil rights since 2014, and have spent, I probably donated a few thousand hours in the legislature working on things, starting with caregiver discrimination, adding whistleblower protections. These are age discrimination. I have a bill drafted, ready to go right now, which basically will increase environmental protection, will increase worker protection, will be a net benefit to the state in terms of revenue, and has the opportunity to have bipartisan support. This is something that I drafted with a number of other public interest attorneys last session. And if anyone, knows, there's kind of this thing like the third time's the charm in Salem. So we've introduced people to this concept. It's not a new concept. It's from the 1800s, but it's a really effective concept. And I think it'll be incredibly important when we are always dealing with scarcity in terms of resources, but we're going to be dealing with that even more going forward.
Great. That actually cues us up for the next question, and I'll start with you. Can you describe the first bill you'd introduce if you were elected to the legislature? And I would love to get a little more detail about what this bill you're describing would do.
Sure. Okay. So this is the first bill because I'm asking it to do a lot of things. But what it does is it says, hey, look, we've got nothing but laws in Oregon, plenty of laws. What we don't have is enforcement of those laws. So you think of someone right now like OSHA. OSHA has, there's existing worker protections in the law, but OSHA hasn't even done any citations yet, although their complaints are up during this 1 month period. So what it does is it allows other people, nonprofits, regular folks, to go and step into the shoes of the state and go and prosecute those violations on behalf of the state. Whoever does the work gets a little portion of the money. The state gets a little bit of the money to increase their enforcement capacity. And then the frontline communities that are harmed by whatever the legal violation was, they get a portion of the money. So and the reason that it can get bipartisan support is because it's a competitive disadvantage for businesses, for good actor businesses, to have to compete with folks that are not being held accountable because they aren't paying minimum wage, because they aren't protecting the environment, because they are otherwise harming our state. So that's my first priority.
Great. Andy, why don't you tell us the first bill you'd introduce in the legislature?
I would increase the amount of required school days. Currently, we require 990 credit hours, which equates to about 165 school days, which is the lowest in the country. The national average is 180. So you think, well, 15 school days isn't that bad. Then you compound that over 12 years. Our students are going to school in some districts almost a full year less than other states, even in the state of Washington. So I think if we are truly about building an equitable future for all kids, we have to raise the floor on seat time in particular in Oregon.
Maxine?
Thank you. So the first bill that I would introduce would be to expand the medical insurance mandate to every Oregonian, regardless of citizenship. And that would have to be with a public option to open up Medicaid on a sliding scale. This is an unprecedented time. We are going to have, as Andy talked about, enormous unemployment. We need to decouple health insurance from employment, and offering an affordable healthcare mandate has to be part of that. We can afford to do it. We're already spending 27% of our state budget, by far the largest allocation to healthcare, and we are getting ridiculously low returns on that investment because of the way it is structured. I have the experience and the knowledge to get that done, and that is absolutely my first priority.
Thank you. Saren?
Yeah, so I'm a progressive, socially liberal Democrat, which is why I've been endorsed by organizations like Bernie PDX and Our Revolution Portland. And the first bill I would introduce would be an Oregon Green New Deal style policy, because that type of legislation has impacted community at the center. It's environmentally justice focused, meaning that those who are currently being harmed by climate change will be at the table making the decisions that affect them. And it has outcomes like moving us away from a fossil fuel-based economy to a sustainable, renewable economy. It has investments in a truly just transition for workers who are displaced by moving from fossil fuels to other economies in the renewable or in clean energy sector. And it also has investments in public transportation, which is great for workers around the state. And it's a racial justice, social justice, economic justice, environmental justice issue that ultimately, rolls up into things like money and politics as well, which we need to address. And so because I would implement something like an Oregon Green New Deal, that's why I've been endorsed by organizations like the Sunrise Movement PDX, which is a youth-led climate advocacy organization, and folks like the mayor of Milwaukee, Mark Gamba, and TriMet board member Kathy Way.
Great. Andrew, could you tell us which single endorsement you are most proud to receive?
I would say the United Farm Workers. They were really excited and said that most politicians or people running for office don't reach out to them. So one Friday afternoon, I drove out to Hermiston to meet with them because they didn't have transportation into Portland. Had a really fantastic conversation with them and just really believe that we have to work for all workers. And currently, we are not providing the protections necessary for all workers.
Christina, single endorsement you're most proud to receive.
I can't believe you're going to make me choose. I'm going to have to say the Oregon Education Association. I'm really proud to have educators. Having a 6-year-old right now and quote unquote homeschooling, I mean, I appreciate our teachers more than ever.
Maxine?
Thank you. So Governor Barbara Roberts would be my my top choice, I guess. She was a mother who was advocating for her child and was passionate about disability rights for her autistic son, and found her way into leadership in a really passion-driven, compassionate manner. So she, I believe, set a precedent not only as the first female governor, but also as someone in leadership who's willing to put compassion and people first. And I would love to emulate her in that regard.
Saren, you've told us about a couple endorsements. Which one are you most proud to receive?
Yeah, I would say Oregon AFSCME Council 75, because I was a member of AFSCME when I worked at Metro, and also they are not fighting for, short, easy, quick wins. They're fighting for big picture systemic change and doing things like making sure we still implement the Student Success Act and receive the revenue in a critical time when people need it most right now.
Great. Nigel, you got a question?
Mark
has one. I'm sorry. Go ahead.
Mark, go ahead.
Yeah, hi. So Christina, you got the OEA's endorsement, which is obviously a huge feather in your cap and probably comes with a substantial amount of money. Everybody else that we're talking to strikes me as a thoughtful liberal. So this question is for everybody but Christina. Why did she get the OEA endorsement? Any one of you can jump in.
Yeah, I actually had an opportunity to talk with the OEA's leadership about that. And I think first and foremost, I honor the work that Christina did for paid family leave. And I think that they understood that she had a history of doing work that was supportive of their values. And having that known legacy is something that no one else in this race could offer. And that, I had a very nice conversation with them. And I think that we all gave them a good run gave her a good run for the money. But fundamentally, it came down to relationships that had already been built.
Thank you. Anyone else?
May I add something? Is this Saren?
Yes, Saren, go ahead.
Oh, okay. Well, I just want to also note that, with a number of these endorsements, it doesn't necessarily mean that folks are saying other candidates are not a good fit or aligned with their values. And it's a tough decision for any organization. They have to do a lot of work behind the scenes to decide where their resources can go, where they have capacity. And, and as Maxine mentioned, there's certain alignments with values that, and a huge matrix of decisions that these organizations make. And I'm proud of the endorsements I have. It's wonderful that other candidates have the endorsements they received. And I think voters should also be aware of the fact that, they need to come to their own informed decisions when it comes to voting. And it doesn't mean that it's an anti if someone else doesn't get that endorsement as well. So it's kudos to everybody who got them. And yeah, it's a good thing all around.
Yeah, I would just echo those comments. I think we need structural change in our education system. Sunset High School right now has 48 kids in a class, in a social studies class before the COVID stuff. And so I think Oregon, when I talk to Oregonians, they want our schools to be performing at a higher level. And so much of my career has been focused on that question itself. So I would just echo what Maxine said and Saren about that, and just acknowledge that we all have different unions supporting us for a variety of reasons. And most of the folks I talked with said this is not about not liking other folks. It's about just supporting one individual candidate and having to make a choice.
Andy, Mark, do you have a follow-up on that?
I have a different question, so I'll hold off.
Okay. No, go ahead. I think it's great. Continue.
Well, I'm Maxine, I'm interested in your perspective. As you know, a number of healthcare organizations in Oregon have been making noise about needing a pretty substantial amount of help from the state government, which I gather is because hospitals are clearing out wings and postponing elective surgeries to prepare for COVID, and as a consequence are losing money. I'm just wondering, A, is that the correct analysis or the full analysis of the challenges that hospitals have in this state? And B, do you support providing a couple $100 million of help to healthcare organizations because of COVID?
Thank you for asking that. So first and foremost, I think that each organization is struggling because this is unprecedented. We don't have structures in place to understand how to evolve our business on a really short timeline. So it is an incredibly stressful situation across the board. Hospitals are, for the reason that you say, struggling because they have stopped all elective procedures, and we are really discouraging patients from coming into the clinics. So my husband's a primary caregiver. He has done all virtual medicine, and he serves the most needy community near Gateway in the state. And well, it depends on how you look at it, but from a socioeconomic perspective. And those patients are not getting the care they need right now. We know that people are having heart attacks at home that aren't getting addressed. They're having diabetic crises that aren't being addressed because people are more fearful of coming in to the ER because of COVID than they are staying at home. So the hospitals are losing money because of that. I think that exactly exemplifies the problem, that hospitals make money when people are sick, and that is fundamentally counter to what our healthcare system should be doing. So do I think that we should be bailing everyone out? Honestly, I think what we need to do is bail out people, keep people first and foremost in our mind. That's why my first bill would be to expand Medicaid to everyone and make it affordable on a sliding scale. If people have the money to get into an insurance program and visit the hospital, then those hospitals will have to evolve their practices in regard to the business structure. And working for a mission-driven organization that we are all salary-based, none of our doctors are losing salary right now. We were able to mobilize our dentists. We have an integrated dental program. They shut down all dental procedures and gave their PPE to the healthcare providers on the front lines immediately. And so we've been able to respond in a way that mobilizes our resources for putting people first and not worrying about the fact that they're losing all the income that dentists across the state are really struggling with. So we don't have a resilient healthcare system. We are seeing that implemented. We are seeing that exemplified in the worst possible way right now. And I don't think doing things in the same old way is the right way. We can't let a good crisis go to waste. We need to change now.
Yeah, and I would just want to jump in and echo this issue that is an enormous problem, right? The profit motivation instead of public healthcare infrastructure And right now we are seeing our for-profit companies competing with the state to get PPE. I mean, this is irresponsible and counterproductive to the crisis. And this is why we need people who are going to actually put people first. This is why I developed a no pharma money pledge. I mean, I think the money in healthcare is an incredible problem, and having, we need people who are willing to do the hard work, that don't have a vested interest in this system. People who, my only vested interest is in civil rights for Oregonians and having equitable healthcare for every Oregonian, including undocumented workers.
So I'd like to jump in, Aaron, if you don't mind. So we have 4 strong candidates in this. It's a Democratic primary, but if whoever's elected here will represent all constituents and all Oregonians, not just Democrats. So could each of you give us an example of how you're independent, an independent thinker, or on an issue in which you deviate from the Democratic orthodoxy? Andy, let's start with you first, please.
Yeah, I encourage you to go to my website and look at my endorsers. I think what you'll see is a really broad coalition. I talked about the United Farm Workers. I also have the district state senator, Elizabeth Steiner Hayward, behind me, have a number of independents and other folks as well. And I think that demonstrates that people are really interested in someone who grew up here and knows the community really well, and someone who's going to push for really building the future that our children deserve. So I would say that if you look at my endorsements, you'll see the broadest base of coalition that will really help me get things done when in office.
But I guess what I'm asking is there a place, maybe you're actually pro-Second Amendment, or you're pro-life, whatever it is. I'm just saying that we're looking for places where you would say, hey, I'm not just a party line or a Democratic rubber stamp. I actually do my own thinking, and here's a place where I may deviate from my fellow Democrats.
Yeah, I mean, the two that come to mind, I mean, I think from my perspective, there were too many compromises made in the last cap and trade bill. I mean, the session didn't happen, but I felt like we need a cap and trade that matches up to California's system, and they created this really piecemeal plan that I mean, I want a cap and trade bill. I want a strong cap and trade bill. And I thought that the Democrats in the House moved too far towards the center in that. And it was not a bill that would really build the future that we need.
Great. Saren, how about you?
Sorry about that. So one example that comes to mind is PERS. And I absolutely could not support the House Bill 1049 that passed in the 2019 session, because I think that's a really dangerous precedent to set, and a downward spiral when it comes to investing in government. It hurts employee morale. It then impacts being able to hire employees and retain them, which then compiles to the workload of current and existing employees, which then yields slower time to respond to inquiries or services for the public, which then makes the public upset and angry with government agencies, which continues to just perpetuate then vilification of government employees. And again, then people want to turn around and take away their benefits. And we know that government employees are getting paid less than private sector counterparts, and they're doing really important work. And we've made promises to them for their future. And frankly, every person in Oregon, state and nationwide deserves a retirement, deserves a real retirement. And it's not just public employees, it's every person across the state deserves a retirement. So no, I think it sets a really dangerous precedent, and it's death by 1,000 cuts. And again, I mean, I think that's a reason that I received an endorsement from an organization like AFT Oregon, who was very opposed to those cuts that came with 1049.
Thank you. Christina, how about you? Where are you independent?
So, look, I mean, it's 70% Democrats in this district, but when it comes to things like transparency and accountability, public records laws, I think that's where I'm going to be a bulldog. I've represented enough whistleblowers to be completely agnostic as to who can be the wrongdoer in a situation at this point. You know, I'm not going to be deferring to any agency heads who are going to come in and tell me why they did something in a certain way. We need to be talking to the frontline workers, the people who are actually are seeing the issues in the system. I mean, just like this unemployment issue. I talked to someone a couple of weeks ago who was telling me, listen, we're working on DOS or something like this. Talk about essential workers right now, folks in the unemployment office, yet our antiquated systems make it so that it's literally a public health crisis for them to do their jobs, even though it's a telephone job. It's a telephone job that they cannot telework for. It's insanity. You know, the other thing is like transparency. I'm going to put my calendar. I want my constituents to know where I am, who am I spending my time with, right? When it comes to public records, there was a racist incident at my son's school, Chapman. So I did a FOIA request. Just tell me, hey, how many times was there an email with the word racism during this school year? The results, it was something like 2,000 results, and they want me to spend $1,000 to get it. This is not how we get transparency and accountability. That's where I'll differ, I think.
Great, thank you. Maxine?
Yeah, I think what we all have in common is that we are very progressive, and that the top place that I'm going to differ from the party is the dependence on special interest investment in the party platform. Each and every one of us, especially the PERS issue, education issues, there's really vested investment in the Democratic Party. And I think what we need to do is back to people, our constituents, keeping them at the center of everything we do. No matter what the special interest group is, they have a certain perspective, and representing broad groups, I think we need to represent people. And so public financing for campaigns and getting away PAC money is really where I think I would be willing to take a leadership role.
Maxine, I'm not sure you answered the question.
So where we're going to be different? Well, I would totally agree with Sarah in that I wouldn't have voted for the PERS bill if you want like something specific. Yep. So we have to put people first. A contract is a contract, and that was, you know, I think, not having thought forward and putting people first in the first place when they made some policy with investments that had a lot to do with special interests. And so I think we wouldn't have been in the situation that we were in if we had always kept people at the center, and that bill shouldn't have happened.
Can I just chime in on that first thing really quickly? If you look at that bill, I think there were two really big flaws that were made by the Democratic leadership. Number one, labor was not at the table for those discussions. And I think I'm a big process person, so they should have been. But secondly, almost 90% of the savings of that bill were just the amortization and changing the payoff schedule. That you could have labor too. It was the other 10% that asked for an increased payment towards the PERS liability that really upset labor leaders. And so I think that was special interest inserting itself, but I think that both the process and the product were really a mistake there, because you could have had some of that savings regardless, and not done it by throwing labor under the table.
I don't disagree with you.
So this is the point in the interview where we're going to ask each of you to ask one of your opponents a question. We find that if you ask each other substantive questions, it sometimes helps us to understand where you differentiate from each other. So Saren, we'll ask you to go first. You can ask one of your opponents a question.
Oh my goodness. Let's see. Gosh, what? Okay. Yeah, let's go with, so let's see. Andy, what do you consider to be your role in being an ally and, using your place of privilege in this campaign itself?
Great question. I'm really proud of a lot of the work that I do at Pacific that acknowledges race, class, gender, sexual orientation in teaching and in schools. And so one of the things we're doing at Pacific, and I really encourage the reporters to look into this if you haven't already, is grow your own program in Woodburn that recognizes middle and high school students who are interested in going into teaching from the Woodburn area, from Latinx backgrounds, works with them to get into college, give them the teaching credentials, and then return to Woodburn to teach in that community. And so throughout my career, I've really tried to diversify the teacher labor force. Throughout this campaign, I've worked pretty closely with the Beaverton Black Parent Union and just had a conversation yesterday on criminal justice reform on our website, focused on communities of color and criminal justice, but really throughout the campaign, reaching out to every constituency to make sure all voices are heard.
Andy, can you ask one of your opponents a question? Bit of a round robin this way.
Sure. I guess I would just ask Christina to reflect a little bit on her experience as a parent of a kindergartner. I think is it kindergartner or first grade? At Chapman, and just talk a little bit about what you've seen in schools right now.
Wow. I mean, aside from them being out, I know for all of us parents, it was one of our first worries was what's going to happen with the other kids that really rely on the school for a lot of the social services and getting the food that they need. It's been devastating to not have our green spaces when I've got a very small apartment and a 6-year-old with a lot of energy. But I think the thing that has been nice is this crisis has demonstrated what we can do, right? Like things like getting our bus lines to actually get food to where it needed to be. That was something we could have always done, and we can't go back. We got to do that going forward.
Great. Christina, we'll stick with you. Could you ask one of your opponents a question?
Oh, sure. So Maxine, I'm curious. My outside perception was that the negotiations around the Kaiser contract with the employees was pretty contentious, and I wonder if, looking back in the crisis, you would have used your role to make sure that the employees are better protected now that we are really seeing this crisis unfold.
So I think that's a great question, except it doesn't, I think Kaiser Permanente is a really complicated organization. So it reflects perhaps not understanding the structure of Kaiser Permanente. So Northwest Permanente is a separate for-profit corporation of which I was the chair of the board. So I had jurisdiction over the governance of our organization. I did not have any operational accountability. And in fact, that is a really important, as you would know, a CEO has operational leadership and the chair of the board has governance leadership. And so honestly, the Kaiser Health Plan and Hospitals is a completely different organization that I have absolutely no, jurisdiction in that area. So I was not privy to any of those negotiations. There was never a time where I was included in any discussions because that would have been absolutely inappropriate as a physician. I stood with the SEIU members. We were definitely, those are the nurses I work with throughout, I work with nurses every single day. SEIU represents some of our nurses at our interstate campus. And for sure, like that was absolutely not something that I had any ability to weigh in on.
Okay, so I'm hearing that you did not have a leadership role and had no ability to make any helpful things for employees.
I would say that I did. I mean, I wore buttons at work, and I was helpful, supported our nurses. And at the same time, I have no more impact in that negotiation than any of the nurses did. Actually, they had more because they work for the organization. I don't work for Kaiser.
Maxine, would you like to ask one of your opponents a question?
Absolutely. So, Saren, I would love to know if I think I know your answer on this, I believe, but if you were elected, would you support the mortgage interest deduction for the top 5% of earners? And I know that that's a contentious issue in our district.
Yeah, I absolutely support repealing the mortgage interest deduction, particularly for second, third, not on first homes, but beyond that, because I do believe that, and great question, Maxine, but I do believe that if you can afford a second or third or fourth home, you can afford the taxes. And particularly in a time when we know that resources are scarce and are going to be becoming more scarce, we need to make sure that folks, people first, as you've mentioned and others have mentioned, have the resources they need to thrive and do well right now. And that money needs to go into the general fund for things like healthcare and education and housing. So yes, I would eliminate the mortgage interest deduction on second, third, fourth, et cetera homes.
All right. Before we get to our final and fun question, I want to quickly go around the room and ask each of you how much money you've raised in this race and how much you have on hand. Sarah, we'll start with you.
Yeah, I've raised almost $40,000 and we have about $20,000 cash on hand.
Great. Christina?
I'm not sure off the top of my head how much we've raised. I think we've got about 40 in the bank. I think we've raised about 100,000.
Okay. Andrew?
Approximately 100,000, maybe 30 on hand.
Okay. And Maxine?
We've raised just over 95,000, and we just paid out a big bill, so we have about 38,000 on hand.
Great.
And can I add something to that question?
Sure.
Yeah, so I just want to highlight how I think it would probably be important to all of us that this is an exorbitant amount of money to have to raise. And this is why Maxine brought it up earlier, but campaign finance reform is so critical because we know that it's a racial justice issue where communities of color, and look at the candidates in this race, communities of color, low-income folks have historically had less access to intergenerational wealth and community wealth, and that's a barrier for people running for office and holding office. And we have to absolutely invest in public financing of elections, limits on campaign contributions, and making sure that folks who share lived experiences with people they represent are actually in office and able to hold those positions. So it's blows my mind that there's so much money that needs to be raised to run for office. It's completely unacceptable.
Agreed.
One of the many reasons I will never run for office. We'd like to ask each of you a fun question, or at least we've found it to be fun, the answers we've received. What's the single experience you've had during this quarantine that you will remember for the rest of your life? Sarah,
oh man. Well, I mean, aside from just thinking about the human impact and toll on people's lives and the economy, I mean, we're all collectively facing trauma right now, but so I will never forget that. But for a little levity, my friends and I participated in the Going the Social Distance Relay, which was a on your own style race relay where we just all ran on our own, but cheered each other on via a video messaging chat app. And so we were kind of able to get together with our friends, but also raise money for Meals on Wheels. And that's the other thing I'll remember is how much people came together to make sure that others are taken care of right now and that we can't go back to quote unquote normal and status quo because it's not working before, it's not working now. And if we don't change things to take care of everybody later and have robust social safety nets, then we're doing something wrong by going back to status quo.
Great. Maxine?
Yeah, I guess my whole life has been turned upside down by this, from the fact that I can't walk in my front door after work, that I have to come in a back entrance and strip down and go straight to the showers, and that my bag has to separate from everything because I don't want to infect my family with the virus that I'm exposed to all day, every day at work. But the most memorable thing that's happened so far is having to have a phone conference with the family of a matriarch. And as she was being made comfort care because we couldn't save her, not allowing them to come into the hospital to be with her. And she was 94 years old and had, raised 3 generations of people who desperately wanted to be at her bedside. And I've never not been able to let family be with their loved one as they die. And that is something that we cannot ever take the risk of having to do again if we can avoid it.
I think you were on mute, but I think you said me,
I
right?
did say Andrew. Sorry. Thank you, Maxine. Andrew.
Yeah. So 2 quick stories. One very sobering. My partner was exposed to COVID and had testing very early on. They work in healthcare as well, and so much of what Maxine has said about the routine of showering and with toddlers, it's hard to explain why they can't hug mommy when she gets home. But that testing actually for her took 8 days. And so we were in kind of an 8-day hold of not knowing if she had COVID or not early on. So that was tough with, again, a 2 and a 3-year-old. On a more happy note, I'm teaching my 3-year-old how to skateboard, and it's awesome. And he loves it. And it's really fun.
All right. And Christina.
Yeah, I don't get out much too. Is that me?
No, that's Mark's headbuds.
Okay. Yeah. So, I don't get out much, but I volunteered the COVID mutual aid, and someone texted me and said, "Hey, can you get groceries for this woman who can't get out?" And so I went to the downtown Safeway and got these groceries. But going from basically seeing nobody, touching nobody, being just completely isolated to this place that it felt like it was Grand Central Station. People literally were touching me. Their arms were like trying to get through to get these, the perishable goods or non-perishable goods. So that was wild to me. And then to see how, our new front line, these workers who are in these grocery stores, they had no PPE. This place seemed like a cesspool to me. So it reinforced for me that, one of the first things we've got to do is make sure that anyone who's on the front line gets workers' comp insurance and doesn't have to fight SAFE, which has got $1 billion to have their medical bills taken care of. It should be a presumption.
Great. I'd like to thank all of you very much for taking the time with us today. We have to wrap up because we have another one of these in 9 minutes. So I'm going to say goodbye. But thank you again. This has been a great conversation, and we really appreciate your time.
Can you please send us the recording?
I don't think we do that before the endorsement comes out, but you can watch it after the endorsement comes out, which is on April 29th.
Okay, thank you.
Thank you. I appreciate the opportunity.
Thanks so much.
Thank you.
Thanks.